Hello, and welcome to For the Love of Family. My name is Katie, and I'm currently studying neuroscience and psychology at the Northern Kentucky University. This video is addressing information about OSFED, or otherwise specified feeding and eating disorders. Just a quick disclaimer, I am not a licensed clinician, so if you are concerned about yourself or a loved one, please seek a professional to get an actual diagnosis. I will provide links in the description of websites where you can find treatment in your area, treatment that'll work with your insurance, or just more information about the things that I'll be covering in this video. So other specified feeding or eating disorders, or OSFED, if you didn't know, DSM stands for the Diagnostic Statistical Manual, and the DSM is what most clinicians in the United States use to classify specific psychological disorders. So to be diagnosed with OSFED, you must be a person with presenting a feeding or eating behaviors that cause clinically significant distress and impairment in areas of functioning, but do not meet the full criteria for any of the other feeding and eating disorders. So what this means, like for instance with atypical anorexia nervosa, it's possible that your weight is not low enough, or you haven't been going through it for a long enough period of time to be actually diagnosed with anorexia, but it is still distressing, the behaviors or symptoms that you are having. So some of the OSFED disorders are atypical anorexia, binge eating disorder, bulimia nervosa, purging disorder, and night eating syndrome. So atypical anorexia nervosa can be classified when all criteria is met except for despite significant weight loss, the individual's weight is within or above the normal range. So they're not significantly underweight for their age, size, and sex, but they are still inhibiting patterns of restriction, of ritualistic eating, things along those lines. So just because they haven't been diagnosed with anorexia does not mean there's not still a problem. There's obviously a problem that they should seek treatment for, but they don't meet the full criteria of anorexia nervosa. The next one is binge eating disorder of low frequency or limited duration. So it's the same, all criteria for binge eating disorder is met, except at a lower frequency or for less than 3 months. So I believe for binge eating disorder to qualify, you have to do a binge at least once a week for 3 months. So if you're not doing it every single week, or you've only been experiencing binges for a month or two, you technically do not meet the DSM requirements for binge eating disorder, but again, there's still a problem that should be addressed. Bulimia nervosa of low frequency or limited duration. So this is kind of the same as binge eating disorder in the sense that you haven't met the time requirements or the frequency, so you're not binging and purging every single week, but maybe it's happening every couple weeks. So there is still a problem, but it is not to the frequency to qualify for the full disorder. But like I'm saying, for all of them, it's still important to seek treatment, as typically when you get diagnosed with bulimia nervosa of low frequency, it then develops into a bigger problem of bulimia nervosa. Purging disorder is when there's a recurring purging behavior to influence weight or shape in the absence of binge eating. So binge eating, as defined, is when somebody eats an extreme amount that is definitely larger than what a normal person of their age and size would for the occasion that they would, at an increased rate, so within 2 hours. And so purging disorder is similar to bulimia or binge eating disorder, but it's the opposite of binge eating disorder, where you're only purging. And this can be extremely dangerous, especially when the intake is very low. Night eating syndrome is recurring episodes of night eating after awakening from sleep or by excessive food consumption after the evening meal. The behavior is not better explained by environmental influences or social norms. The behavior causes significant distress and impairment, and the behavior is not better explained by another mental disorder, as in binge eating disorder. So this is a disorder that's typically seen in younger individuals who are still living at home. Maybe their 3 meals are planned out by their parents, so the only time that they have access to binge or access to their own binging is at night, or if they're trying to hide it, somebody who shares a similar living space with somebody and they are trying to hide it, so one of the only times they can do it is when everybody else is asleep. And this is different from binge eating disorder because the only time that they do it is at night. With binge eating disorder, they binge quite frequently anytime throughout the day, anytime they can be alone. So this is definitely something to look out for in somebody who has a shared living space or somebody who's still under their parents' roof. And that is the last one that we are going to cover in some of our lesser known eating disorders. Like always, everybody is different. So if this sounds like somebody, or somebody might have this if they don't have any of the symptoms, it's important to go to a professional to get a professional diagnosis so you can have the best form of treatment. Thank you for watching my videos. If you have any questions, feel free to comment down below and I will try to address them in a future video, as well as share your personal stories down below to create a community, and hopefully you guys can help each other out. Thanks for watching.